Hi, and thank you for taking the time to hear our story and learn what we came to know. How and why medical cannabis can be a safe and effective tool for people at the end of life. I'm Chela.
And I'm Dave. And right up front, we'd like to say that we're not doctors or medical professionals of any kind, and nothing you hear in this presentation should be considered medical advice.
Right. We work below the line in film and television production, but in 2010, after my mom was diagnosed with Alzheimer's dementia, we dove into family caregiving and became fierce advocates for people at the end of life.
In memory of Mom, and to honor our journey together, we started providing care gap training for other family care partners at CoachChela.com and created Cannabis Helps Dementia podcast.
We've interviewed dozens of doctors, nurses, professional researchers, administrators, other caregivers, and people living with dementia about how cannabis helps all the way till the end.
Like it did for our family.
Right.
We've since published a short guide on medicinal cannabis and specifically CBD for seniors, available on Amazon.
What if there was a scientifically recognized system in the human body that regulated every other bodily system and it wasn't taught in most medical schools?
That would be weird.
Right? How many of you know that we all have a system like that called the endocannabinoid system, or ECS?
But to help us get on the same page, we made this short video about the ECS to help understand how cannabis works in the body.
Cannabis has been the subject of so many jokes and stereotypes, and so much propaganda, that it's hard for some people to imagine that marijuana could be a legitimate medical treatment.
Maybe you smoked some pot in college, or tried the brownie your nephew gave you, or you or a loved one may have overused cannabis and can't imagine how it could be medicine. But science tells us that cannabis is indeed just that.
It's impossible to understand that cannabis is medicine without knowing something about the endocannabinoid system.
Like that it exists, for instance. A quick PubMed search yields over 6,000 research studies on the subject.
Problem is, most medical professionals don't study anything about the endocannabinoid system in medical school or continuing education, due in part to the outdated federal policy on cannabis prohibition.
Cannabinoids, the chemical compounds in cannabis and other plants as well, interact with many parts of the body. Until the 1990s, we didn't know how exactly.
Then researchers traced where a THC molecule landed and began to discover that we have a system in our body that regulates all the other systems through chemistry.
The system in the body that interacts with plant cannabinoids was discovered, and then researchers found chemicals that our own bodies make that interact with that same system.
It's called the endocannabinoid system, and the compounds we make in our bodies are called endogenous or endocannabinoids.
The endocannabinoid system is established in scientific literature. Researchers are finding that the endocannabinoid system is involved in balancing nearly every system of the body.
It's interesting that even though the endocannabinoid system is established science, most healthcare professionals don't learn about it and still don't understand how cannabis helps people.
Make sure you ask your doctor if they've studied the endocannabinoid system before you ask them if cannabis medicine is right for you.
Okay, now that we know a little about the ECS, we can understand how CBD and medical cannabis could be helpful at easing symptoms at the end of life. The trailblazers of cannabis medicine therapy have always been the patients and family caregivers, occasionally with guidance of brave clinicians. A more recent movement by those in the fight is to introduce CBD and medicinal cannabis for use in palliative and hospice care. At the end of my mom's journey living with Alzheimer's disease, when she was in hospice and receiving palliative care herself, I was building a binder full of research showing the benefits of medical cannabis for people living with dementia, and came across a study that found CBD helped morphine work better. At Mom's end of life, despite all the morphine she was on, she still had very labored breathing. It's sometimes called a death rattle. We tried a few milligrams of full-spectrum CBD oil between her lips and gums every hour, and it completely eased her breathing for 4 days until she peacefully left us. The hospice staff has reached out to me many times since then to say that my mom's was the most peaceful passing they'd ever witnessed. According to a 2019 study, an accumulation of many prescription drugs at the end of life increases the side effect symptoms from those drugs and decreases quality of life. When CBD or medicinal cannabis is introduced, for many people, the need for a number of prescription medications is reduced as well.
Cannabis connects with endocannabinoid system receptors that can help relieve severe pain, muscle spasms, and reduce inflammation.
People also use cannabis to relieve nausea, constipation, improve fatigue, sleep issues, and cannabis can stimulate appetite and weight gain.
Cannabis is helpful with overwhelming emotions, anxiety, fear, and mood issues during the end of life. Everyone deserves to have a sense of well-being. Palliative and hospice care aim to optimize one's comfort, but we don't think anyone should have to wait until the end to improve their quality of life.
Cannabis has a long history in medicine, from ancient China to Egypt and Israel to a physician in 1843 who describes the therapeutic actions of hemp tinctures on several different patient populations, including palliative care.
Cannabis is known for heightened sensory perception. Cannabis helps us appreciate music, flavors and smells, sights and sounds. It can also help heighten awareness of moment-to-moment presence, which is valuable throughout life.
Cannabis can be therapeutic for patients faced with the despair of a terminal illness and the loss of function that accompanies it. Also, a mild euphoria could bring about a sense of well-being. In areas of the U.S. where cannabis medicine is not legal, clinicians can recommend hemp-based CBD and also prescribe an FDA-approved synthetic THC in a product called Marinol. It's used to treat loss of appetite that causes weight loss and muscle wasting, and to treat severe nausea and vomiting caused by cancer chemotherapy.
Consult with a knowledgeable healthcare provider to help manage multiple medications. You can find one through one of these organizations.
Researcher S.K. Agarwal in palliative care and oncology addresses a terminally ill patient's right to access cannabis in facilitation of a patient's right to access experimental treatments in line with their wishes and beliefs in service of hope.
Several states have adopted laws that protect end-of-life patients' right to access cannabis medicine in certain federally funded facilities like hospitals, nursing, and veterans facilities.
California lawmakers got clarity from the Center for Medicare and Medicaid Services, CMS, before passing California's Ryan's Law, signed by the governor in 2021. The author of the bill wrote, quote, CMS has confirmed that the Medicare and Medicaid regulations do not address the use of medical cannabis, and CMS states that it is not aware of a provider that has specifically lost funding or been penalized for permitting the use of medical cannabis. Furthermore, CMS states it would not cite healthcare facilities for allowing medical cannabis for use unless the U.S. DOJ has made an adverse finding.
Currently, the United States Department of Justice is prohibited to use any federal funds to interfere with state medical cannabis laws, and the Biden administration has made every indication that it will not interfere with state cannabis laws, medical or recreational.
This wasn't enough for California facilities, however, and the legislature recently passed a clarification to Ryan's Law, SB 988. It says basically that facilities can't stop an end-of-life patient from arranging for a loved one or caregiver to help administrate medicinal cannabis.
It's been 25 years since the citizens of California passed Prop 215, becoming the first state to make medicinal cannabis legal, or at least decriminalized.
Subsequent legislation created the nation's first quasi-legal medicinal cannabis program. Much has changed since 1996 and even 2010 when we first began using medicinal cannabis for mom.
Yet medical professionals are still not required to know about the ECS or how cannabis might help their patients.
Some of the obstacles to getting this medicine to those who need it most include more than 85 years of prohibitionist propaganda at every level of society,
which then created a lack of provider education and promoted fear in American culture about using cannabis at all.
Paying for your products is almost exclusively done in cash, as cannabis remains on the most restrictive Schedule I of drugs, making it federally illegal to do any credit card transactions. Additionally, state legal cannabis businesses don't have access to normal banking or standard business expense deductions.
Labeling and packaging requirements of state legal cannabis products differ from the requirements for labeling and packaging of pharmaceutical products used in a medical setting, creating a conflict and hesitation by facilities to use this safe and effective tool.
Cannabis is thought of as other narcotics in states that allow it, and facilities are required to inventory those medicines at every shift. Most cannabis packaging is not created with this in mind.
According to the National Conference of State Legislatures, as of May 2022, a total of 38 states, the District of Columbia, Guam, Puerto Rico, and the U.S. Virgin Islands, have approved comprehensive, publicly available medical marijuana cannabis programs. 11 other states have low THC, high CBD laws. Idaho, Nebraska, and Kansas have no legal cannabis programs. CBD from hemp is legal federally, and 49 states allow hemp-based CBD. Idaho is the one exception, having no legal medicinal cannabis or CBD as yet.
Laws pertaining to the use of CBD and medicinal cannabis in care facilities vary from state to state, and many that have made cannabis access legal have created guidance for use of medical cannabis in their care facilities. Most, if not all, federally funded nursing homes or VA facilities will not allow any form of medical cannabis or CBD due to the fear of losing funding over the Schedule I status on the Controlled Substances Act.
As we learned from California's Ryan's Law drama, this fear seems unwarranted, as there's never been a case recorded of this happening, nor does the Centers for Medicare and Medicaid Services have any regulations that address the use of CBD nor medical cannabis. In our case, it became a don't ask, don't tell situation. After the first nursing home kicked Mom out for a positive THC drug test after we were honest about what we had found to be so successful. They said there'll be none of that here, which initiated the drug screenings. We never discussed using medical cannabis with the next and final care facility we found, but it was close enough to home that I could bring her some medicine every day for 4 years until the day she passed in 2019.
Also in 2019, the Society for Post-Acute and Long-Term Care Medicine put out a white paper on the use of marijuana in nursing homes. In part, it says that they support patient-centered decision-making. If there is consensus from the clinician and resident that marijuana has substantial clinical benefits that justify the risks, the facility administration must have established policies and procedures in place.
And clinicians and staff caring for residents receiving marijuana in these settings should have training and education in the administration, monitoring, and use of marijuana.
The National Council of State Boards of Nursing believe that nurses should know about the benefits and risks using medical cannabis and first published guidelines in 2018 with regular updates.
To start the conversation with your providers, present data supporting the need for medical cannabis use. Share studies with them. Include observed benefits and expectations. Happier patients make happier staff and lower turnover. Work with your local ombudsman if you have any issues. My mom had greater focus and interaction when she was medicated with cannabis. She laughed, smiled, and communicated with us. Cannabis helped Mom have a carefree attitude about losing her mind, and CBD even soothed her at the end. Cannabis helped ease my mom's symptoms from the moment we started using it until her last breath, but only because we were willing and able to make sure she had it.
Thank you for joining us today. We hope you feel you've learned a little bit about how cannabis medicine can help people at the end of life.
Connect with us at CoachChela.com for resources, events, guidebooks, private coaching, and more, and on the socials at Coach Chela Consulting.
Check out the Cannabis Helps Dementia podcast, where we post interviews with leading-edge clinicians, researchers, family caregivers, and people living with dementia about how cannabis helps at CannabisHelpsDementia.com.
We're wishing you all the best in your journey.